Now, sadly, and we've documented this on The Angle over the last 7 years, American children today, we've all seen it. They're more overweight and they're sicker than ever. Why? Well, to answer that question, the president launched Make America Healthy Again to do something about it. And today, HHS Secretary RFK Jr. released this report. It was very highly anticipated on children's chronic illnesses. The findings themselves were sickening. More than 40% of American children have at least one chronic health condition. That's drastically increased since the 70s. Also soaring the rate of childhood cancer, the rate of childhood obesity, of course, and autism. The commission's report found the major driving forces behind these diseases are poor diet, aggregation of environmental chemicals, lack of physical activity, and chronic stress. And by the way, they added over medication to that list.
There is a reason that the Maha sided with you, President Trump. It's because this administration has the bravery to tell the truth and solve problems through innovation and not nanny-state regulation.
Here to discuss the report, Dr. Drew Pinsky, host of Ask Dr. Drew on Rumble and chief patient officer at the wellness company. Dr. Drew, has any other presidential administration approached addressing this problem as these guys are trying to do?
No. Nothing like this has been attempted. And in fact, what we see in the previous 4 years was attempt at squashing and covering up anyone who dared to come up against the narratives that they were pushing. Senator Ron Johnson just had a hearing where he revealed the extraordinary evidence of myocarditis in young males, and that the administration and the FDA and the NIH knew about it and suppressed this information, leading God knows how many kids to serious illness and potentially death. Now we're talking about doing something. There were several interesting things in this report. One was, you mentioned the obesity and the chronic illness, 1,400% increase in medicine prescribing to young people, and yet they are sicker than ever. 1,400%. We expect solutions in a pill. They're not there. Solutions are in a spiritual growth, in our families, in attending to the mental health of these kids, giving them proper nutrition, limiting exposures of all types. Listen, we live in a time when everyone expects life to be made better by medical interventions, pills, vaccines, you name it. I was raised by a family practitioner, and he hammered into me that any medicine, any time you interact with the medical system, it is dangerous, and you must be able to prove that the risk is dramatically outweighed by the rewards. And we just haven't even asked the questions, and finally the questions are being asked.
Well, I think, again, you go into, your own, medicine cabinet. You're like, why do I need, all these different medications or even over-the-counter medications for swelling, and then you find out there are all sorts of natural remedies that friends of mine have been using for years. I'm just starting to, look into a lot of all this, but it's very upsetting, extremely disturbing that I think there's been a massive cover-up of what's gone on in our food industry and what's gone on in our pharma industry. Big money and big problems for our young people and all Americans.
At very minimum, look at the results. Have they made us healthier? No, they have not. Something is very, very wrong. And, Dr. Makary pointed out today at the event, he said, look, we do the best job in the world when it comes to our CAR-T inhibition and our checkpoint inhibitors and our ability to do these very fancy therapeutics. But we shouldn't have to be playing whack-a-mole with the American people. They should be healthier, and we shouldn't have to chase them with all these advanced interventions that we have. Cancer is up, obesity is up, chronic illness is up. We need to do something about it. And my hunch is there's going to be a really serious mental health problem at the core of this, or spiritual problem, however you want to shape it, that we're going to have a conversation about. And our families may sit at the cornerstone of that conversation.
As always, Dr. Drew, there was a study that just came out. It was a respected study that eating out is one of the key reasons for the obesity epidemic. And as a kid, did you eat out all the time? Like, oh, let's get takeout. Let's eat it. We cooked whatever, my mom bought, and that was it. And it was simple food. It was mostly simple. We didn't have a lot of fancy food.
Yeah, look, the less processed, the better. The less sodium, the better. The fresher, the better. The more that you get off trees and out of the ground, the better. But the fact is, back when I was growing up, eating out was like a big deal. It was a special event. And there certainly wasn't all the crazy processed fast food everywhere. It can't be good for us. It isn't good for us. Look, here's something we're losing track of. Being hungry, it's good. Working hard and exercising, it's good. Ordinary misery is good. It builds resiliency, and it gives us a sense of well-being and efficacy that you cannot get any other way.
All right, Dr. Drew, I got to get back out in my garden, weed that garden with a big stick as I was doing over the weekend. Thank you very much. All right, coming up, what Biden did that gave his team extra anxiety. More details on this? Yeah, next.